I came to coaching after a very difficult professional disappointment. So I had set up and was leading a palliative care program, hospital-based, and it was decided that the program was financially not viable for the institution, and they needed to make changes, and that was very difficult, that
Yep.
professional change. And I felt like I had failed the community, the patients, even the people that I had, trained in the field. So I was at a point, I mean, there was some time I took a leave of absence. I also, at that time, had the responsibility of care for my parents, so
Mm.
elder care. And I was trying to, weigh and balance these things, but I wasn't sure that I was going to stay in medicine. I wasn't sure that there was a place
Wow.
for me. And so those were some of the things I was struggling with.
Yeah, and maybe left with a little bit of distrust for the system or
I think
feeling.
that would be, there's a lot of
Yeah,
changes that have occurred in 20 years. And yes, that was a struggle too.
got it. Anything that we haven't covered so far that you kind of were looking for some help with at the beginning of the program?
I was really wanting to have a better relationship, I guess, with medicine
Yeah,
as a profession. Yeah.
got it. And fast forwarding 4-ish months here, where would you say that your relationship with medicine is today?
I'm definitely in a much better, hopeful. So more a sense of hopefulness, a sense of confidence,
Mm.
definitely feeling that I have something to bring to the table because I was questioning that at one time.
Yeah,
So from that degree, I would say, um, I'm definitely benefited. I'm also learning to question those internal dialogues that, really haven't been helpful.
yeah,
The
100.
negativity bias that
Yeah.
I know is human nature, but stopping and questioning these things that aren't serving me.
Hmm. And um, I mean, that's beautiful to hear. And like when you talk about that confidence and that hopefulness, and it sounds like you're in a much kind of just more in tune place or more ready to keep practicing.
Mhm.
On a day-to-day basis, can you kind of walk me through what looks different? Like maybe you used to spend a certain amount of time thinking about X and now you think about Y, or maybe you're spending your time differently, but how does life look different for you?
Well, I think a little bit better and more positive attitude, feeling, regaining maybe some of that trust, learning, starting to see my own self-worth that I can bring to the table, appreciating the experience. And the truth is, when I did take a leave of absence, I missed patients. I missed that patient care. So now I actually appreciate it when I am just, with the patient for whatever, that time is, and able to just be there. I mean,
Wow.
really value that. Um, and I appreciate it in a way that, I mean, I think in a new way.
Wow. I think someone's cutting a little bit of onions back there. Um, that's really beautiful to hear. Um, it sounded like, and you were a real winner when it came to the group coaching. You made a lot of strides there, and, or at least from my mom's perspective, you were there a lot, and your presence was really valued. And then you also had some one-on-one coaching. So, can you take a second to just walk me through, the helpful aspects of both those sides of your program?
Mm. Well, in the group setting, what I really appreciated was um, hearing from other physicians and just a wide variety of challenges that they might be facing. But there was usually a commonality. There was an affirmation. So just hearing from people like, oh, like that sounds awful,
Yeah.
because
Yep.
have I been imagining this? And so getting that affirmation that other people have had similar experiences and or maybe internal dialogues or internal questions, I found that really valuable. To me, it was kind of, I appreciated that um, Dr. Gazelle comes from the background of hospice and palliative medicine.
Right.
So, there's that sense of like, oh, like she gets me because we're not popular, so to speak, or trendy.
Right.
we don't bring in like a lot of profits, that kind of thing.
Hmm.
Um, and so working with someone who kind of understood what draws people to that field was beneficial. With the one-on-one, you can get a little bit into the weeds, maybe. And that's kind of a, cliche, but go a little bit maybe deeper into challenges, maybe some of that self-talk,
Mm,
recognize that this is troublesome, explore how you can bring about more self-compassion. So that also, they're both valuable, and I appreciate both aspects of it.
definitely. Um, have you tried anything like therapy or coaching or anything similar to this in the past?
So I was new to that.
Okay.
Yeah, I had taken, well, the other thing I kind of appreciated about it, I had taken a mindfulness class based on that UMass model with Dr. Kabat-Zinn.
Yeah.
Not with him, but someone
The
who
MBSR program.
trained in that arena. So I really appreciate, like, the mindfulness piece was also familiar.
Hmm.
And that was my, I had taken a class in that historically, but so that was kind of where I was coming from.
Got it. You had a little bit of that foundation that you could bring to the
Mhm. Right.
awesome. Um, in terms of that group coaching, like, did you see any familiar faces throughout the program? Did it start to feel like a community, or was it more just a different cast of characters every time?
No, there were definitely some familiar faces, and there was some community, sense of community. Yeah.
Wow, that's great. Um, I guess the last question that I would ask while I'm recording this, and this has been great, and I think this will be really, really helpful for people that are thinking about making this decision. And just kind of thinking about, putting yourself back 4 months, not knowing what to expect from this. And then for everyone who's watching this who may not be sure if coaching is the right fit, what would you say to
Mhm.
someone who maybe has that sort of distrust or isn't sure where medicine's going to fit into their life like you were at? What would you say to them in considering coaching and working
Well,
with
what
this?
I kind of took away from it is there are a lot of challenges today in medicine, and we're not sugarcoating that. I mean, there are a lot of systemic issues, but learning to work within and finding a place to move forward. That was what my experience was. So learning to work with what is, I guess, would be kind of a way of saying that. Uh, I I found that personally very valuable. A chance to have your challenges recognized. The other, just a chance to be heard. I mean, as a palliative care doctor, I think that's one of the most powerful things we offer is we offer people a chance to be heard and hear where they're coming from, hear what their priorities are. And
Hmm.
so it's kind of that experience.